Hello, my name is Beth Kalvas. I'm an F31 Predoctoral Fellow at the Ohio State University College of Nursing. My research focuses on the relationship between exposures in the critical care environment, sleep, and delirium in young critically ill children. My passion for delirium research is directly related to my training as a nurse. Florence Nightingale once said that the very first requirement in a hospital is that it should do the sick no harm. Instead, Nightingale encouraged nurses to put patients in the best possible condition for nature to act upon them. Her environmental theory highlights the importance of cleanliness, ventilation, limited noise, uninterrupted sleep, proper nutrition, and sunlight in promoting recovery of the sick. In fact, in her seminal work, Notes on Nursing, Florence Nightingale made direct associations between delirium and excessive noise, lack of sunlight, and disrupted sleep. Yet today's pediatric critical care environment is characterized by excessive light and sound exposure and frequent nighttime caregiving. This environment likely contributes to the altered sleep patterns experienced by critically ill children. Providing support for Nightingale's early observations, we now know that these environmental exposures and resulting sleep disruptions can impair cognitive functions such as attention, working memory, and emotional regulation, as well as disrupt the circadian rhythm of melatonin release, which has neuroprotective properties. Environmentally induced circadian rhythm dysregulation is one hypothesized pathway to the cognitive changes observed in delirium, and sleep-wake cycle disturbances are often observed in children who are experiencing delirium. I choose to focus on critical care environmental exposures and sleep patterns in my research because they are inherently nurse-driven. As the primary bedside caregiver, the nurse determines the type of environment in which children will receive treatment. Nurses are uniquely positioned to prevent delirium through environmental modification and regulation of the circadian rhythm, interventions which place the patient in the best possible condition for recovery. Yet so deep-rooted and universal is the conviction that to give medicine is to do something, or rather everything, and to give warmth, cleanliness, and air is to do nothing, that this important aspect of nursing practice is easily overlooked. In my future work as a nurse scientist, I will continue to root my research in the ideas espoused by Nightingale in her Notes on Nursing. My long-term career goal is to become a leader in improving the neurocognitive symptom management, clinical outcomes, and long-term health of critically ill children by optimizing the pediatric critical care environment. On World Delirium Awareness Day, let us remember that the unique role of the nurse remains as outlined by Florence Nightingale, to place critically ill patients in the best possible intensive care environment to receive life-saving treatment, heal, and promote long-term health.